So first up, we've got David Osborn, who's a health and safety consultant. David's been a vocal advocate for health and safety in health and care sectors throughout the pandemic and in the public inquiry. He's got over 30 years of experience as a health and safety professional, and he continues to challenge the unscientific rhetoric of COVID spread. So I'll pass you over now to David. I will give you a minute warning after 5 minutes, David. Thank you.
Yeah, thank you very much, Leslie, and thank you for inviting me to talk to the conference again. So I will be as quick as I can. Thank you for the introduction. I won't explain who I am. That's been done very well. So we've already heard in conference much about things that we expect to be put in place: carbon dioxide monitors, air filtration, purification systems, and such like. Yesterday, I spoke about the importance of consultation about health and safety with stakeholders, trade unions, etc. I'm not going to go over that ground again. If you want to see that, it will be on the recording. I want to cover new ground, which is basically I must just screen share at the moment. I've got the authority to do that. So are you seeing?
Yes, we can see what you're sharing, David.
Good,
Brilliant.
thank you very much. Okay, I've only got about 3 or 4 slides, Leslie, don't panic.
Okay.
But I think it's an important message I want to get across this morning to you, okay? So the Declaration of Rights and Demands is what this conference is all about. And I'll be honest with you, I think there might be one thing missing, okay? Together against COVID, but there's no mention of planning preparation for future pandemics, whenever that may strike us, or the existing one getting worse, which it could, hopefully, God forbid it. So the question is, should we include something for that? And in that demand, you, the trade unions, professional associations, should have a seat at that table, at that planning table. We tried it June 2021. We were completely rebuffed. When I say we, I mean BMA, RCN, RCM, the alliance I work with, representing 1 million or more healthcare workers, and we were just turned away. They took no notice whatsoever. So you need to be there at the beginning, make sure it happens, okay? So my forte, my speciality, if you like, is RPE, respiratory protective equipment. I've been asked to talk about standards, and it's the standard of RPE that I want to talk about now. I've got 2 slides for that. Most of us be familiar with the tight-fitting respirator mask known as filtering face piece, FFP3s being the better standard, which requires this fit testing process, either quantitative or qualitative, and that was a major problem. As you can see, massive failure on the fit test rate. I think up to 40% of fit tests failed. People have different shaped faces, different faiths, different religions. We're talking, I mean, today's session is about inequalities and disabilities, and that is why this is so important. When they did the planning for pandemics, they did not consider people of different faiths, people of different religions. And we've got a very diverse NHS workforce, and they should have done. The Equality Act came in 2010. Only a time to think about it. Not comfortable. Why they chose FFP3s, I don't know, but for long term, if you're a nurse or a doctor looking after a ward of cohorted COVID patients, having to wear those FFP3s for a whole shift is really not on. You need something else, and there is something else, and there's something better. And I want to talk about what that is. Apart from which, we heard from colleagues yesterday in the breakout room I was in about the difficulties of communication. If you've got one of these big white things, or even a baggy blue slapped across your face, and you're talking to people with mental health issues. So it's a problem, and you also need eye protection. If you do get droplets in the eye, they're infected, it is a route of infection. So these things look very weird, they look very spacey, but you have the benefit of your own personal filtered, clean air supply as you go about your work with your patients. Okay, now the ones I'm showing, powered respirators, PAPRs as they're called for short, have been around for donkey's years in industry. I'm well familiar with them. But the industrial ones are big, clunky things for welders and metal fabricators and all the rest of it. Not suitable, not designed for healthcare. So at the beginning of the pandemic in Southampton University, when they had 2 of their staff end up on ventilators right in the early days, they took a bold decision. We're going to throw the IPC guidance in the trash can. And they did. And it's a bold decision. But they did. And they developed this gentleman here, Professor Elkington, Paul Elkington and his colleagues, developed this at pace from very rudimentary equipment. Basically, what we have here is a pump, readily available and quite cheap, an air pump, like a fan, if you like. HEPA filters from, which you believe Dyson, mention trade names, I don't know, from vacuum cleaners, HEPA filters, high grade, high efficiency HEPA filters, a bit of easily obtainable flexible tubing that would take it up to a face piece, and then a hood. So many advantages. No fit testing required, suitable for all face shapes, sizes, BAME, any face, turbans, beards, it doesn't matter. Okay, comfortable. You've got this cooling, refreshing airstream down over the face, which you know is germ-free. Good communication for the patient to see the healthcare workers smile at them, and for deaf people to be able to lip read. These are all considerations, for the future. Okay, they were developed in wave 1, but by wave 2, just about every member of staff in that hospital, whether they were clinical or non-clinical, porters, cleaners, as I say, they were all wearing them. They were crying out for them. This gentleman walked onto the ward one day with one of these that he'd made, and everybody just looked at him. What on earth? And when they realised what it was about, they were clamouring, can we buy one? Can you make one for us? Please. And they were produced by a local company in Southampton at pace, and could have been, as my colleague Barry Jones said at the COVID inquiry, arrangements were in place with Jaguar Land Rover to mass produce these. By the second wave, you could have all had these things. What went wrong, I don't know. I hope the inquiry will find out why that didn't happen. Because these were the systems.
One minute, David.
That's fine. I'm with you. I'm ahead of you. So very, very useful things. Very popular. Staff feedback was where we were frightened, where we were fearful for our lives of going to work in the hospital. We're not anymore. We're comfortable. We're confident. That means a lot. The actual sickness rates plummeted. They were amongst the lowest in the country, similar to those at Addenbrooke's and places where they decided to switch to FFP3s and again throw the IPC guidance in the trash can. Cost effective, pay for themselves. They're more expensive to buy, obviously, than a pack of FFP3s. But by the time you've been using them for a while, it's cost effective. They pay for themselves. Yeah, they're environmentally friendly. No mountain of waste from FFP3s as they're discarded. And that's all I want to say, Leslie. I hope I've got the message across. I'll send the PowerPoint over, because there is a link there that people can click on if they want to learn more about this. And that's me done. Thank you very much.